Hello, and welcome to Berkeley Center for Latin American Studies panel discussion on migration, the US border, and COVID-19. I'm Beatriz Mans, Professor Emerita at UC Berkeley and the former director of the Center for Latin American Studies, and I will be the moderator. We have a very wide audience today from coast to coast in the United States and from many countries abroad, from Canada to Asia, Latin America, Europe. And we're very pleased to have this diversity of interest because indeed this is a very critical, timely, and grave reality we are confronting. Tens of thousands of asylum seekers have been deported by the US government, and others are being prevented from entering the United States, abrogating their rights under US and international law. Now, tens of thousands are stranded on the Mexican side of the border in cramped, unsanitary, and dangerous conditions. And others have already been sent back to their own menacing country. Our first panelist is Professor Stefano Bertozzi. He has held positions in public and private institutions in the United States and Mexico. He's currently Professor of Health Policy and Dean Emeritus of the School of Public Health at UC Berkeley. Professor Bertozzi.
Thank you very much, Beatriz. I'm going to share my screen and say a few words here at the beginning about the evolution, not so much the evolution, but the current state of the epidemic in both the US and Mexico. And I really appreciate the invitation from you and Professor Shakin to participate in this. Now, first, this is a map of the world. And it's not a map of the world of where the cases have been. It's a map of the world of where the current cases today, this is the map from yesterday, where are the current cases, the people being infected over the last 3 days. And we can see here, for example, that in China, where the epidemic began, they're down to less than 1 case per million inhabitants. In fact, substantially less than 1 case per million inhabitants. Europe and Iran, which is where the epidemic went next, are already falling significantly in terms of number of new cases. The US has become the epicenter of the epidemic in terms of total number of new cases. It's the highest in the world. But here, it's the number of new cases per million population. So it's adjusted for size of the population. And we can see here that Latin America is in fact a hotspot now in terms of the epidemic. If you look at it in terms of new cases per million inhabitants, with the West Coast having higher rates of new cases even than the United States per million population. This next slide shows you what's happening over time in these countries. But the axis here on the bottom is not time. It's, well, not time in the sense of calendar days. It's days since the epidemic reached the same level in the population. So in this case, it's the time that has passed since the country reached 1 case per million per day in that country. So what that means is that you have countries where the epidemic got there earlier and later, all aligned to the same point in time. And what you can see here is that in Europe and the United States, the epidemic grew very quickly and very early. It got to Latin America later. And in most countries, Peru is the exception here of the Latin American countries that I'm showing you, Peru, you can see, climbed at about the same rate as Europe and the United States. But Brazil, Mexico have climbed more slowly. But, big difference, by 30 days after the country reached that threshold of 1 case per million, Europe and the United States had started to come down. Now, the United States, as you can see here coming across, hasn't come down very much. It's a pretty flat curve. It plateaued more than it fell. But Italy, Germany, France, the United Kingdom, to a lesser degree, have all come down significantly from their peak. But what you can see here is Peru, Brazil, Mexico are still on a straight line up. There's no evidence, exception of the last couple of days in Brazil, and that can just be reporting delays, that there has been a significant plateauing of the cases. And the same thing is true in India. India was even further behind in terms of when the epidemic started, but it's still on a pretty straight line increase. This is basically the same thing, except that it's deaths. Now, one thing that I didn't point out on the previous slide is that the vertical axis here is a log axis. So this is 0 to 10 and 10 to 100, right? So what we're talking about here is that India is approaching 5 or 6 cases per million, while Peru has just passed 100 cases per million. These are an order of magnitude difference from one of these lines to the next. And Brazil has passed the United States. Mexico has passed France and Germany and is approaching Canada. Now, on the deaths, you can see here that Mexico has already passed Spain and is approaching Italy, passed Iran, which was heavily affected early on a while ago, and Brazil is soon to pass the United States. Remember that because deaths occur about 30 days after infection, deaths lag infections. But the other thing about deaths is that they are less underreported than cases, because it depends less on testing than it does to identify cases. Now, this is a slide to show that just because we can show a number for a country doesn't mean a country has a single epidemic. The United States here has a very unequal distribution. The epidemic in Wyoming bears no relation to the epidemic in New York and New Jersey. They're more different than countries are from each other in terms of the severity of the number of cases we've had so far. But there's a real danger of looking at just where the cases have been, because that's not what's happening in the epidemic today. This is the map of the United States of where the cases are changing today, or yesterday in this case, not where they've been. And you can see here that New York and New Jersey are rapidly falling in terms of the number of new cases per day. Even New Orleans is falling, but other parts of Louisiana are rising rapidly. In California, you can see here, I work with the California State Prison System. Pelican Bay, you might think that because it's rural and isolated is safe, but in fact, it's in one of the hot spots in California up at the northern California-Oregon border. In Mexico, the same thing is true. From state to state, it's extremely heterogeneous, but here you can see in Sonora, which I'll show you a little bit bigger, that within the state, at the level of municipios or county equivalents, you have that level of heterogeneity again. And if I blew up one of these municipios, you'd see that even within the municipio, it's a very heterogeneous distribution of cases. Here you can see, for example, at the border, here's Sonora bordering the state of Arizona, and here you can see the state of Arizona. Now, in this case, the state of Arizona is showing you where the cases have been, just like Mexico is. So there you can see that the Native American populations have been heavily affected in Arizona and New Mexico. But here in the hotspots, I don't have a hotspot map for Mexico, but here in the hotspot map, you can see that the borders in Arizona are where the hotspots are right now in terms of where cases are rising the fastest. I want to close almost by just showing something that is common between the United States and Mexico. And that is that as we think about relaxing social distancing, as we think about how we might move from the situation we're in right now to one where we can return to economic activity, that because of what I've shown you of how local the epidemic is, we have to have local information to be able to make local decisions about what to open and what not to open. And the United States and Mexico are at the bottom of the distribution in terms of the amount of testing we're doing per the number of cases that we have. In fact, Mexico is right at the bottom. The United States is up at 9, but that's because it's about doubled in the past couple of weeks. The United States was also extremely low compared to other countries, but both countries remain very low compared to even countries in the rest of the Americas. And just a couple words that, that Beatriz had asked me to comment on an op-ed that I did with a Stanford professor in the New York Times about the use of public health rationale to exclude asylum seekers from the United States. And the editorial is basically making the case of how we are using a public health rationale in an illegitimate way as an excuse to flout US asylum law. So if we truly believed that crossing the Mexican border posed a severe public health threat, then we would apply the public health measures uniformly to anybody crossing the border. But that's obviously not the case. Truck drivers can cross the border, but asylum seekers cannot. And so even if it were true, which it isn't true, that we can't be safe with respect to people crossing the border, even if it were true, it's blatantly not being applied in that way. And so you can look at the op-ed if you're interested, but I think that that relates to our discussion. And I'm very happy that later on we'll get to participate in the discussion. And Beatriz, I know, has questions from many of you who are listening that she will come back to us with. So thank you very much, and I'll give you back the screen, Beatriz.
Thank you very much, Stefano. By the way, the website of the Center for Latin American Studies has a link to that op-ed that Lucas Gutentag and Professor Bertozzi wrote. Before moving on to the next panelist, Stefano, can I ask you a quick question? It was just announced this afternoon that Trump is withdrawing from the World Health Organization. What impact do you think that might have?
It's just mind-boggling. I mean, can you imagine that in the middle of a pandemic, we withdraw from the Global Health Agency? It's stunning. Now, what impact will it have on WHO? I strongly suspect that others will come in to address that gap, at least until the election. I think that if this country has 4 more years of Trump, that may pose a severe concern with respect to WHO. But what that implies in terms of lack of cooperation. Now, I'm also optimistic that many US authorities will continue to collaborate with WHO, even if the US is temporarily suspending its membership. But this is clearly just a blatant political act which is intending to deflect blame from the actions of the administration onto WHO for the state of the pandemic in the United States. And given that the US had many people in WHO from well before the epidemic, the idea that the US wasn't kept informed by WHO or arguments like that are just completely specious. I mean, ridiculous, laughable if it weren't tragic.
Thank you. My co-convener, Elizabeth Oglesby, is a professor of geography and Latin American studies at the University of Arizona in Tucson. She has lived in Guatemala and worked in Guatemala for many years. She has extensive research experience there, and as well as ground experience in Arizona and at the border. Liz, can you tell us what's happening in Arizona, especially in the shelters recently?
Sure, yes. Thank you very much for this invitation. Let me just say very briefly what has changed in recent months with respect to migrants and asylum seekers and the humanitarian aid efforts in Tucson and Southern Arizona, and what has not changed. What has changed is that a year ago at this time, there was a very broad community humanitarian effort in Tucson and Southern Arizona to receive migrants and asylum seekers, mostly from Central America. And we all remember the headlines at that time, right? When the Trump administration was using the rhetoric of border crisis to push through policies that it wanted to push through to stop asylum seekers and migrants. I want to say, though, that that moment last year was really the moment of least border crisis that we've had here in Southern Arizona, because people were able to come up to the border either through an official port of entry or outside of an official port of entry, cross the border, wait for the Border Patrol to pick them up, and then make their requests for asylum. They were brought to the shelters in Tucson and other places. There were months when the shelters in Tucson were receiving 200 or 300 people a day. At first, it was mostly Guatemalans and Hondurans, and then later in the year, we saw an increase in the number of Mexican asylum seekers and also people from other places. At the very end of last year, and January, beginning of this year, with the rollout of the Remain in Mexico program on the part of the Trump administration, which was finally rolled out in Arizona at the end of last year, meaning that asylum seekers would no longer be able to cross to make their petitions, but would have to remain in Mexico while that process was going forward. We saw a sharp decline in the number of asylum seekers who were crossing and coming to the shelters, but we still saw people. There were still releases of medically vulnerable people, pregnant women, or people with specific health conditions. So the shelter in Tucson was still fairly active up until the pandemic. Now, because of what Stefano was just mentioning and what he wrote about very powerfully in the New York Times op-ed, no one is crossing. So those vulnerable people are being made to remain in Mexico, which my colleagues will be able to talk about. So that is what is different. Even though we still have shelters that are open and available to receive people in Tucson and Southern Arizona. Some of the shelters have closed, but our largest shelter, run by Catholic Community Services, is still open to receive people. There is a medical team on standby, there are volunteers, there's food, there are beds to receive people, but no one is being allowed to cross, even though we do have very strict health protocols in place to be able to receive people. So that's what's different. What is the same, I would argue, is the Trump administration's efforts to use the border rhetoric, this time connected with the pandemic, in order to push through policies that it has wanted to do, namely to shut down asylum on the southern border. I think we, obviously need to really question that kind of border crisis rhetoric, as Stefano did in his New York Times op-ed. In Yuma, for example, when we saw on the map the hotspot in Yuma for the pandemic, I don't think it's really clear that that hotspot is necessarily related to the border dynamic or border activity, or not entirely so. I believe also one of the causes of the outbreak in Yuma is an outbreak in the state prison system among guards and detainees. So I would say we don't necessarily have a border problem in Arizona right now with respect to the pandemic. We do have an incarceration problem, however, in Arizona with respect to the pandemic. I will just end so that I can turn it over to my colleagues who can talk much more in depth about what's going on in Mexico. But I will end by saying that there are some advocacy groups in Arizona who've been able to get small numbers of detainees released from immigration detention. And if people who are outside of Arizona but are interested in supporting those efforts, some of those groups are the Florence Project for Immigrant and Refugee Rights, a local group here in Tucson called Keep Tucson Together, and the ACLU of Arizona. So I think I'll close there to give my panelists plenty of time, and look forward to the discussion.
Thank you, Liz. Katie Sharad is the Director of Communications of the Kino Border Initiative in Nogales, Sonora, Mexico, on the Arizona-Mexico border. She has lived and worked in the US-Mexico borderland since 2003. Katie, while there are strikingly different conditions along the 2,000-mile border between the United States and Mexico, can you tell us what are the conditions like in Nogales? How have they changed over the last several months given the coronavirus?
Yeah, let me just pull up this slideshow here. Okay. Let's see. Okay. Yeah, so thank you so much for allowing me to be with you all today. I'm actually in Nogales, Arizona right now, and was in Nogales, Sonora just a few hours ago. So the border is open to what is considered essential traffic, and asylum seekers, as Stefano said, are not included in that calculus. Very briefly, I'm just going to describe what the Kino Border Initiative is and does. Our three main points of work are humanitarian aid, education, and advocacy to people in migration. So under the humanitarian aid banner, we receive people who are who have just been deported, who are preparing to migrate, and people who have arrived to the border to seek asylum. And we provide them with, until the pandemic, 2 meals a day, medical care, a change of clothes, legal assistance through the Florence Project that Liz mentioned, pastoral accompaniment, social work, that might be, and then a few other services like phone calls and check cashing when they get deported from detention centers, but that's another conversation. And then education is multifaceted. Partly we provide education to folks from the US mostly, who come to the border to understand a little bit more what's happening here and to kind of engage in a process of mutuality of, conversations and educating one another so they can be better advocates when they return to the US. And then also human rights education for the people in migration. And then, increasingly education for the younger migrants, the kids, 5 to 15 or so who are out of school while they're out the border. And then advocacy. And our advocacy is primarily driven by the things that the migrants tell us, the problems that they're observing, their treatment in Border Patrol custody, their experiences under migration protection protocols, et cetera. And so then we take what they're asking us to do and to use our connections and their voices as they request to advance policies of greater justice. So it's a tiny little building, or was. We just opened a new center. But that right there is everything that there is. It's about 300 square feet. So all of that happens there. And then people just, hang out outside during the day because the shelters in town, again, up until the beginning of the pandemic, were closed during the day, and you could only go there from about 6 p.m. until 6 a.m. So here's just some comparative statistics between March and April, and all of you obviously know what happened, what the difference would be between those 2 months. So these figures are just those who came for the first time, those who arrived because they were recently deported, because they were returned under the migration protection protocols, because they were preparing to cross, or because they were preparing to seek asylum. So the actual number of people we see in a month, for instance, in March, I think it was about, we served about 15 or 20,000 meals, but these are just the people who arrived for the first time. So in March, we received 636 people from 11 countries. Most of the folks from Mexico, I would say about 2/3, are going to be those who have been deported. And the reasons for that would be multiple, whether they were crossing the desert for the first time and then returned, shortly after that, or those who were living in the interior of the US and were picked up by ICE for whatever reason and then returned to Mexico. Most of the people from Honduras, Guatemala, El Salvador, and Nicaragua that we saw were primarily those who were returned under the migration protection protocols. People from those countries didn't tend to cross the border near Nogales or to wait in the line there. They would go other places, but we got a lot of people from MPP. And then the remainder of the countries, Cuba and Venezuela in particular, as well as the other number from Mexico, would be those who were waiting to seek asylum in the United States. And through the process of metering, which prior to the pandemic, it was, about a 3 or 4 month wait time before their number was called. If they were Mexicans with children, some would be allowed to be released to sponsors. Those from Cuba, Venezuela, and other places would generally be returned under MPP, sometimes sent to detention, very, very occasionally released, but mostly returned under MPP. And then you see in April 2020, there's a significant difference. Essentially, what's happening are, I would argue, 2 or 2.5 things. And one is that fewer people are getting deported through Nogales. In the past, everyone who was deported was removed through Nogales because it's one of the larger border cities in Sonora. There's a lot of social services. There's access to bus stations. There's access to migrant shelters. There's access to legal services. So while, of course, we work against widespread deportations or deportations of most sorts at all, if you're going to be deported, Nogales had at least the resources generally available to work with those who've been deported. And now what's happening is that people are being returned to whatever port of entry is nearest to where they got picked up. So for instance, about an hour ago, a friend of mine texted me that he was near the town of Ajo, which is about 2 hours west of Tucson, and then he headed to the port of entry near there. And he saw the Border Patrol just releasing a mom and her, young teenage son, 13 or 14, through the port of entry there. They'd been walking in the desert for 3 days. They weren't given any water or food by Border Patrol, and then were kicked back to this town. And the population of Sasabe, Sonora is probably 60 people, 70 people. There's nothing there. So I don't know where they're going to go, how they're going to get a bus ticket, how they're going to eat. So just the people who had been deported to Nogales are now being removed through much more remote and rural ports of entry. And then the other two things that are happening are just that fewer people are coming to seek asylum because they know that the border is closed to them, that the United States considers asylum to be non-essential. And so that if they arrived here, they would just be waiting at this point in indefinite limbo. And MPP essentially doesn't exist anymore. The interesting thing about these statistics, I don't remember what the Hondurans or Guatemalan situation was, but Mexico has agreed to receive under this rapid expulsion order people from Mexico, people from Honduras, people from Guatemala, and people from El Salvador, but they won't receive people from beyond that. So the 7 people that you see represented there from Ecuador and from Nicaragua, they were actually returned under MPP. And that's just the system of waiting in Mexico for your asylum court date, which is then held in Juarez, or is held in El Paso, but you have to travel to Juarez. So yeah, now our services are just a lot more limited at the Kino Border Initiative because of the pandemic, because we have, medically vulnerable staff, elderly staff, and just because the possibility, if a migrant were to get sick, the medical services here are much more limited. Also, a lot of our volunteers, particularly those who provide the legal services and the medical services, are no longer able to or allowed to cross the border because of their age or because of their organizational restrictions. So those services are essentially no longer available to migrants. It's just another casualty, I think, of the pandemic, where we're able to do what we can. People, will get clothes, toiletries, food for the entire day. But a lot of our services, because of just the realities of, the pandemic and the border closure and how it affects different organizations and individuals, means that there's just not as many services available as there were even a month or two ago. Oh gosh, I was trying to think of the current challenges for migrants and asylum seekers in Nogales, and this is not an exhaustive list. It's a very, very partial list. But as I mentioned, there's just a lot more limited services. It's very hard to access free medical care now. Legal services are a lot more limited. Several of the shelters in town closed, and the one that really remains open has just been operating at a much more reduced capacity. And at that shelter, all of the men have to leave during the day. The women and children are allowed to stay in the shelter, but then the men have to leave. The closure of the border to non-essential travel. And so asylum seekers are just waiting indefinitely for a chance to seek asylum in the United States. No sense of when that will resume. The rapid removals from the US with no way to seek asylum for residents of Mexico, Guatemala, El Salvador, and Honduras. For those who are returned under the migrant protection protocols, they have to travel to El Paso, they have to travel to Ciudad Juarez, which is over 10 hours away and through pretty hot cartel territory on generally public buses, just to receive a piece of paper that says when their court date has been rescheduled to, because the courts are closed for the foreseeable future. And several of the people I know who are under MPP who've been returned to, who went to Juarez and then returned to Nogales, just describe a pretty harrowing journey, just having to be at the port of entry in Ciudad Juarez at 4 a.m., of being treated with disrespect, of having to travel on crowded buses and use all of their savings to make that journey just to get a piece of paper that doesn't indicate anything. And then also just the economic difficulties. There's fewer spaces available in the shelter. And so some people are able to rent apartments. And the way they've traditionally funded that is through two sources. And one is through finding kind of odd jobs in Mexico. And some people are able to find jobs at like the maquiladoras and the factories here in town. Some people get odd jobs at like the car wash. There's a Cuban car wash business. There's some folks who sell candy or who shine shoes, things like that. Just enough to kind of pay a little bit for rent if you combine it with other people. And then in tandem with or supported by folks, family members and friends in the United States who send remittances. But almost everyone I know describes how their family members have also been economically impacted and so are no longer able to send any remittances or any money to them or as much as they had been. So it's very difficult to find shelter. And then just the dangers of contracting the virus. A lot of people have to be out and about all day, like the men from Juan Bosco, that one shelter. And then there is some harassment from like local law enforcement who for a while, and this kind of gets unevenly enforced, but there are checkpoints throughout the city and you're not allowed in Nogales, Sonora to travel with more than one person. So if you're in a car with another person, then you'll get ticketed, fined, you can get your vehicle taken away or you can get put in prison. So if you're out on the street with a family member doing essential business, there's just the possibility of harassment and then also of exposure. There's just no particular way to safely shelter in place for a lot of people. Oh man, and I just thought this was like, how do you even capture this? But Mexico and US policy toward people in migration at the southern border during COVID-19. I think I would echo a lot of what Liz said. I think the pandemic has been a pretext for what the Trump administration has long been seeking to do, of just to seal the border off to people in migration and particularly to asylum seekers. And every year that I worked at the border under his administration, I saw it continually getting sealed off and sealed off. Another thing I think I'd like to point out, and I suppose Beto can speak to this as well, is just the Mexican government's collaboration in this. I can't speak to the collaboration of the López Obrador administration throughout the country, but just their acquiescence in receiving people returned under migration protection protocols, and now all of their citizens who are returned from the desert, as well as the citizens of the three other countries. Most of these policies would be pretty difficult to enact in the absence of some collaboration with the Mexican government, and they are certainly going along with it now too. And I think the effect that this is having is essentially just making the challenges of people who are seeking asylum, who are fleeing danger, who are needing to migrate for whatever host of reasons they need to, just far more invisible. We deport people further away and more quickly. We put them into detention centers, that are further and further away from the public eye or harder to access. And so the refrain that I continually hear here in Nogales is just, we feel more and more forgotten, we feel more and more invisible, please don't forget about us. And so I think that's just in part like the intention of these policies and the effect it's having on people here who are, for whatever reason, have found themselves at the border during this time. So that's where I'll end and turn it over to other folks.
Thank you, Katie. Our next panelist is Adalberto Ramos. He's the director of the Centro de Atención al Migrante Éxodo. This is the only shelter for asylum-seeking migrants in Agua Prieta, which is right by the US-Mexico border across from Douglas, Arizona. Adalberto will speak in Spanish, and Liz Augustby will do consecutive translation in English. Adalberto, can you describe the conditions in Agua Prieta, especially since the coronavirus pandemic and the deportations from the United States?
Sí, muchas gracias. Buenas tardes, más que nada. Y muchas gracias por la invitación y a este espacio que se me ha dado.
Thank you very much for this invitation and for the space that you're giving me.
Desde la segunda mitad del 2018, el flujo de solicitantes de asilo aumentó espontáneamente aquí en Agua Prieta. El 80% ha sido mexicana y el otro 20% ha sido de lugares de Centroamérica, sobre todo de Honduras, Guatemala, El Salvador, y también hemos tenido solicitantes de Cuba y de Venezuela.
Since the second half of 2018, the number of asylum seekers has risen in Agua Prieta. 80% of these asylum seekers have been Mexican. The other 20% have mostly been Central Americans from Honduras, Guatemala, and El Salvador. And we've also seen people from Cuba and Venezuela.
Y ahora con el COVID-19 ha reducido desde la población solicitante de asilo desde CAME.
And now with COVID, the numbers have reduced of asylum seekers.
Desde el 13 de marzo, la población permanece aislada como medidas preventivas. Nosotros no contamos con infraestructura para poder ayudar más a la población migrante.
Since March 13th, with the preventative measures that people have taken in Agua Prieta, the population has been self-isolating, and we don't have the infrastructure to care for migrants.
Y nosotros con la población que se quedó con nosotros en el albergue, a partir desde el cierre del albergue que nosotros hicimos desde el 13, pues nosotros atendemos a esta población dándole atención pues sobre todo el hospedaje, la alimentación, atención médica y educación y sobre todo también atención psicológica.
So for the people who were in the shelter when the shelter closed on March 13th, we are trying to give them still shelter and food and medical attention and also psychological attention.
Mencionando aquí por parte de las autoridades, pues existe la indiferencia por los tres niveles del país, que es el federal y el local, en donde hay un doble discurso sobre esta población.
So there's an indifference on the part of Mexican authorities, both at the federal and local level, where there's a kind of double discourse around the issue of migrants.
La Comar, que es la Comisión Mexicana a Ayuda a Refugiados, ha detenido todo el proceso de refugiados, no tiene buen presupuesto para poder continuar.
Comar, which is the Mexican Commission to Aid Refugees, doesn't have the budget to continue.
Todavía acaba de salir en esta semana oficialmente diciendo que todos los procesos van a estar parados para esta población de refugiados. Y eso es terrible porque realmente afecta mucho a esta población y sobre todo en las ciudades donde está más de esta población migrante.
Just recently, Comar announced that all processes to aid refugees were being stopped, and this is terrible because it's a very vulnerable population, especially in the cities where a lot of refugees are.
El CAME ha seguido brindando el servicio al interior de la casa a las familias que ya se quedaron desde marzo. Prácticamente están en cuarentena y es muy difícil para estas familias permanecer tanto tiempo aisladas en el albergue.
Our shelter has continued to try to reach out to people who are now in quarantine under very difficult conditions.
Las dificultades que nosotros nos encontramos, pues es el rechazo de ambos gobiernos, tanto de Estados Unidos como México.
Some of the difficulties that we have encountered are the rejection towards these people, both on the part of the U.S. government and the Mexican government.
En estos tiempos del COVID, nos encontramos con una población históricamente desprotegida, cierre de fronteras, sin conocer las razones por las que huyen las personas de sus comunidades.
So in this time of the COVID pandemic, we're dealing here with a historically vulnerable population and also the closing of the borders, irrespective of the reasons that may have caused people to flee their countries of origin.
Y el futuro, en el futuro realmente es muy desalentador para las personas solicitantes de asilo, orillados a cruzar el desierto con el riesgo de perder la vida.
The future is very discouraging for these asylum seekers, leaving perhaps the only option to try to cross the desert and risk their lives.
Y aquí los vemos, son obligados nuevamente esta población a contratar los servicios del traficante o del pollero.
So once again, this population is being forced to rely on the services of coyotes or human traffickers.
Y también mencionarlo, muy importante, con algo que se encuentran aquí en el norte, es el crimen organizado, porque ellos tienen que hacer por el pago de cruce, realmente que pagan por cruzar su territorio, ellos así lo dice el crimen organizado.
Mm-hmm. And one of the problems that we see here in the north of Mexico is organized crime, whereby migrants are forced to pay a toll to cross territory that is controlled by organized crime.
Y realmente para desde mi postura, desde mis observaciones, el este COVID-19 es el pretexto perfecto para Estados Unidos y para México, para reducir el flujo de migrantes y solicitantes y evitar el retraso y el proceso de la regularización para Estados Unidos.
So my observations from the work that I've done is that this pandemic is the perfect pretext to reduce, on the part of the governments, to reduce the flow of migrants and asylum seekers.
Entonces, realmente para Estados Unidos fue perfecto para él este COVID-19 cerrar totalmente las fronteras de Estados Unidos con México. Y esto ha afectado demasiado, no solamente desde Agua Prieta, sino también a todo el norte o a todas las casas del migrante que hay en todo el norte de México con el sur de Estados Unidos.
So COVID-19 has been the perfect pretense for the United States to close the border with Mexico. This has had terrible consequences, not only in Agua Prieta, but for all of the migrant shelters in northern Mexico.
Y ya para terminar así, las familias no pueden regresar a casa ni ir a Estados Unidos. Realmente están parados en la frontera en el norte de México. Y es de verdad muy difícil para nosotros como de la sociedad civil poder seguir atendiendo a esta población.
So just to finish, these families cannot go back to their countries of origin, nor can they continue on to the United States. So they are trapped here in the north of Mexico. And for civil society in this region, it's an extremely difficult situation not being able to attend to these populations.
Yo les comparto desde la realidad de Agua Prieta lo que está pasando, muy breve así. Es sobre ahorita, Agua Prieta no tenía deportaciones desde el 2015.
So I'll just share a bit about what's going on specifically in Agua Prieta. We have not had deportations since 2015.
Y ahora con lo del COVID, están siendo las deportaciones expeditas por esta frontera.
Now with COVID, we are seeing deportations here again.
Y es triste, como ya lo mencioné, que las autoridades federales y municipales no les están dando ninguna atención a esta población. Son vulnerables y salen sin tener información de a dónde ir o quién les pueda ayudar, ni cómo nos puedan canalizar a nosotros porque también tenemos nosotros el albergue cerrado.
So this is very sad because the federal authorities are not providing any attention to the people who are being deported, who are very vulnerable, who are being deported with no information about where to go or what to do. And we are not they're not being sent to our shelters. We are not able to attend to these deportees.
Y pues estamos muy preocupados como organizaciones de la sociedad civil, poder continuar ayudando a esta población, dándoles toda la asistencia que ellos necesitan humanitariamente. Es lo que nosotros podemos hacer desde Agua Prieta, y también lo hablo desde las otras casas del migrante que se encuentran en el norte.
We're very worried, those of us from civil society, about being able to attend to these populations, to the deportees and the migrants, not only in Agua Prieta, but in other migrant shelters in northern Mexico.
Entonces, realmente agradezco este espacio en donde les pueda compartir realmente la preocupación que estamos viviendo desde el norte de México, desde Agua Prieta, esta situación con la población migrante. Muchas gracias.
Thank you for this opportunity to share what's going on in Agua Prieta in northern Mexico and the concerns that we have. Thank you.
Thank you, Adalberto, very much. That was quite a powerful testimony. You mentioned that that your organization, the Centro de Atención al Migrante, has been providing psychological attention to the migrants. Can you give us a sense of what kinds of psychological issues you see there?
Sí, realmente nosotros desde el año pasado, desde que el flujo de solicitantes ha crecido aquí en Agua Prieta, en las entrevistas que le realizamos a cada una de las personas, nos detectamos cómo vienen, cuál es la situación, y desde ahí vamos viendo qué necesitan, qué ayuda. Entonces es cuando nosotros los analizamos a un psicólogo que tenemos desde el albergue.
Since last year, with the rise in the number of asylum seekers coming through Agua Prieta, when we would do intake interviews, we would see the needs that they had when they came, and we contracted a psychologist.
Y ya el psicólogo es el que les da el seguimiento, porque sobre todo las familias están expresando salir, no sé, ahora salen no porque no tengan trabajo, salen porque están siendo desplazadas de sus comunidades, amenazadas con quitarles incluso hasta sus hijos.
So the psychologist did follow up with the people who arrived at the shelter and saw that really the reasons that were forcing people to flee from their homes, and it wasn't just that people were coming to get jobs, but rather people were being forcibly displaced, including threats against them and their children.
Y entonces emocionalmente vienen destrozadas estas familias.
So they come emotionally destroyed.
También quiero mencionar que este seguimiento que hacemos es gracias también a una financiadora que es CCM México, que nos está apoyando para que podamos contratar los servicios de un psicólogo y de 2 trabajadores sociales, para que ellos sean los que estén dando el acompañamiento o el seguimiento a estas familias y poder saber cómo podemos ayudarles de la mejor manera.
So I should say that this follow-up that we were able to do is thanks to the financial support of CCM. ¿Qué es CCM? ¿Qué quiere decir CCM?
CCM quiere decir Comité Central Menonita. México.
Okay, so this is financing from the Mennonite Central Committee in Mexico that's allowing us to do the psychological accompaniment for asylum seekers that came to the shelter.
Thank you very much, Adalberto. We have very little time left, and we have received many questions. Some of them have already been answered. For example, that the Mexican government and refugee organizations in Mexico, such as Comar, really are not receiving the funding necessary to provide support to the migrants at the border. Here is a question about what the migrants themselves might be doing to prevent the spread of COVID-19. Are they themselves being organized to address the spread? What else could be done, such as Mexican policies or community groups, NGO efforts, or assistance from international organizations?
Beto, ¿quieres empezar o quieres que yo empiece?
Pues puedo mencionar algo. Realmente esta población, ¿cómo se está preparando? Pues nosotros damos las recomendaciones, estamos dando las recomendaciones que se nos están dando.
So I can just mention, we are following all the recommendations that we receive.
Y realmente sí hay organizaciones internacionales que nos están apoyando para cómo orientar a esta población y decirles cuáles son los seguimientos que tienen que hacer para que ellos mismos no puedan correr el riesgo de infectarse.
Or international organizations are advising us as to the protocols that we share with migrants, so how they can best protect themselves.
Entonces, las organizaciones internacionales como la OIM, ANUR y Comité Internacional de la Cruz Roja están muy al pendiente de estar apoyándonos con cubrebocas, con artículos de higiene personal. A todos los albergues en el norte están apoyando.
So international organizations like the International Organization for Migration, the United Nations High Commissioner for Refugees, and the International Red Cross have been helping us to obtain masks and personal hygiene kits. There have been aid to all the shelters in northern Mexico for those things.
Y estas organizaciones están apoyando mucho de las organizaciones de la sociedad civil.
And those international organizations are helping quite a bit with local civil society organizations.
Y solamente quiero terminar diciendo que por parte del gobierno realmente no se espera mucho apoyo. Tenemos que ser muy sinceros. No se espera mucho apoyo y realmente a esta población, como lo mencioné, está muy olvidada. Gracias.
So I'll just conclude by saying that we don't expect very much from the government, from the Mexican government, because this migrant population is pretty much abandoned by the government.
Thank you. I have another question here. I think this might be addressed to Stefano. I'm just going to read part of it. Basically, is there an effective strategy to convince a fearful public here in the US that the expulsion and deportation of migrants does not make us here in the US any safer?
Well, I suppose I'm an eternal optimist that facts and truth can help to convince people, but this has been a trying time for people who would like to believe that that's the case. So as we mentioned in our op-ed, if we have protocols where we can make going to the supermarket safer, then certainly we can receive people at the border similarly. We can space families out, we can have appropriate protective equipment for people receiving asylum seekers. We have protocols that we are already implementing in this country in our court system for domestic people who are in the court system to reduce exposure in legal proceedings. So all of those things are clearly possible. And there's no reason that they can't be applied to asylum seekers. I think, as was mentioned previously by other speakers, this is really using a public health excuse to advance a pre-existing agenda that has been thwarted by the courts previously, and not yet thwarted by the courts in this case. It's also, I think, distressing. I'm very happy to hear from Adalberto that he's getting support from some international organizations. But at the same time, we're not treating this as an international refugee problem at the border with the kind of international mobilization that would accompany this if it were a refugee situation elsewhere. And I think one of the other questions that that I have is, what might we be able to do to bring that kind of international attention and support to this situation? Because the circumstances being described by Alberto are just heart-rendering. And we had a conference in San Diego about the health conditions in detention facilities. And this morning I was on a call about the health conditions in our own California state prisons, where we have seen repeated outbreaks also in the federal prisons that are based in California. So we know that these are very high-risk environments where people are either in a shelter where they can't appropriately socially distance, or, as we heard earlier, where they are forced to leave the shelter during the day. The idea that you have sheltering in place with appropriate protective measures is just a fiction if people are not able to do that. So it's a very sobering day. And Alberto, muchas gracias for what you have said. I think it's really sobering. The other thing that is actually I'm learning here is the difference in the pattern of expulsions, with expulsions to places that don't even have the basic infrastructure that other places do. And it seems to me that we should do more of that fact.
Stefano, also, do you have any sense of any research being done about the COVID-19 among deportees going back to Central America or Mexico?
So there is, I know, research that is trying to get underway. We launched recently with the UNAM a joint funding project for binational research. And one of the applications that I recently reviewed is looking at prevalence of COVID in shelters in Tijuana, looking at that as a pilot for what could be done more broadly, and really trying to get a better handle on understanding what are the determinants of risk, which kinds of shelters, which kinds of practices put people at greater risk, and also who is at greater risk. One, I suppose, fortunate irony is that people who are able to get to the border tend to be younger and healthier. So you don't see people with the same levels of chronic disease and obesity as you do among the people who are most vulnerable more broadly in society. But of course, the flip side of that is that you have, as people have mentioned, very high levels of stress, and that, of course, contributes negatively. But I don't think we have nearly a good enough handle on what is being done. I would say the other thing that we need more study on is the conditions in US detention facilities, many of which are operated by private providers and are, if I think the situation is bad in the California state prison system, I know it's worse in other areas with much less transparency than we have here in California.
Thank you very much. I'm afraid our time is up and we're going to have to conclude at this point. There were many more questions. I'm sorry we were not able to bring them up and get answers to them. I want to thank each one of the panelists for this very serious, insightful, informative, and powerful discussion. We invite the audience to check the web of the Center for Latin American Studies, where you will be able to see next week online this panel as well as others that we have had. And again, I want to thank each one of the panelists for your time, for the information you provided. This was very, very valuable. We're deeply grateful. Thank you all.
Thanks to you as well.
Thank you.